is Brisa Virgin, and the time is 9:05 in the morning. Today is July 14th, 2021. I am recording this as we do meeting minutes. I do ask that if you are not speaking, that you please mute yourselves. If at any time you would like to speak, please feel free to either raise your hand by clicking on the hand emoji on the top of your screen, or please feel free to unmute yourself as well. Again, you can either raise your hand or you can unmute yourself. I am going to be the moderator today as well, as Crystal Baselli is out of the office today. So please let me know, again, whichever way is easiest for you, either raising your hand or unmuting yourself. Today is the tribal consultation for July. And I did post in the chat, and I will go ahead and post one more time in the chat the link to a survey that we did. So if you wouldn't mind taking a couple minutes filling that out, that would be much appreciated. This is for us to work on building on our tribal consultation processes, and just to ensure that, and to improve on these meetings. So that survey is there on the chat. Please feel free to fill that out. Also, at the conclusion of this meeting, I will send out another email with that survey link, and please feel free to share with your cohorts, tribal members, anybody. This link will close by close of business on Friday, July 16th. So again, that survey will end by close of business by 5 p.m. Friday, July 16th. So again, that link is saved on there, is saved on that chat for you to access. So we will get started. On the screen, I am sharing my screen and you're able to see the agenda. We will continue scrolling down. Is Augustine Jorges, are you on the call, Augustine? He has volunteered to do our opening, our cultural opening. Again, if you don't have a question or you're not speaking, please mute yourself so that we don't hear an echo. And Augustine, I do see that you're on.
Brisa, he may be on twice. I see 2 entries, so that could be.
So Augustine, perhaps if you mute one of your devices, it might stop the echoing.
Greetings. I'm not sure why I have 2 accounts open.
Yeah, Augustine, if you're on your cell phone and on your computer, maybe just turn down the volume on one of your devices, and then that should stop the echoing by turning down the volume completely.
And Brisa, I'm going through and just muting all the telephonic participants from this end. There are about 10 unmuted, so maybe that'll help.
Perfect, thank you.
Is that better?
Yes, a lot better, Augustine. Thank you so much.
Well, thank you for the opportunity of giving this opening prayer. I know it's been a difficult time during this COVID pandemic, and it's truly an honor to be asked to give this prayer. And for myself, I've been working closely with the Reno Sparks Indian Colony and their division being Hungry Valley, the tribal COVID test sites, and it's definitely been a challenge in many ways. And daily prayers have been going up to the communities, to the tribal communities. So let's take this time and give thanks and prayers. Let us pray. Dear Creator of all creation, we thank you for this day. We thank you for the clear water. We thank you for the clean air. We thank you for the breath of life within each of us. At least we take it for granted. We thank you for the values of life and the blessings that you've poured upon our communities, that we can sustain our cultural values and lifestyles. Lord, we thank you for the ancestors who prepared the way for us to continue working through the challenges that come daily with the health disparities and justices and injustices that occur. We pray for direction and guidance. Help us in every resources, financially, physically, emotionally, spiritually. We pray that you continue to guide us and direct us and give us a unified vision on how to better support our communities. And we pray for our leadership. And we thank you once again for all that you do. In Jesus' name, amen. Thank you once again.
Thank you, Augustine. Wonderful prayer. Thank you very much. So next on the agenda, we will move to introductions. If we have any chairpersons, any tribal leadership, ITCN representation, or tribal clinic directors, would you please unmute yourselves or feel free to type in your name and what tribe you're representing on the chat box. So again, if there's any chairpersons or vice chairpersons or ITCN representation, please feel free, or tribal health directors, please feel free to unmute yourselves and introduce yourselves, please.
And Brisa, this is Homa. Since we did mute the phone lines, we might have to unmute those briefly. So because I don't think people can just as call in, I don't know how they would activate that, or if there's a code they would have to use.
Okay, thank you, Homa. I will go ahead and do that at this time.
Hello.
Hi, good morning.
Good morning. This is Andrea Harper from the Reno Sparks Tribal Health Center.
Wonderful, thank you. I believe I see Ken Richardson as well on the screen. Hi, Ken. Thank you for joining us. And Oma, are you able to unmute the phone call, the callers that were muted? Because it's not giving me the option.
Sure, let me give it a go. If you go to the, oh, weird. Maybe they have muted themselves. Because like now I'm seeing that it just, okay.
Hello, can you hear me now?
Yes, I can. So again, feel free to unmute yourselves or also put down in the chat or send me an email at the end as well of your attendance during this meeting. So I know Andrea Harper introduced herself. I'm just kind of going down the list.
Hi, my name's Carrie Brown. I am with the Reno Sparks Indian Colony. I'm not a clinic director, but I'm the Human Services Director.
Perfect. Thank you. Thank you for joining us. Okay, and then do we have anyone from IHS with us on the call today? Okay, and then I will move on to the State Division Tribal Liaisons. Would you please introduce yourselves?
Hello, good morning. My name is Priscilla Costa, and I am the Tribal Liaison for the Director's Office at the Department of Health and Human Services.
Hello, I am Nikki Haig, and I am the Tribal Liaison for Aging and Disability Services.
Good morning, I'm Tiffany Davis. I'm the Tribal Liaison for the Silver State Health Insurance Exchange.
Good morning, I'm Fran Maldonado. I'm the Tribal Liaison for the Division of Child and Family Services.
Good morning, this is Yvette Cullen, one of the Tribal Liaisons for the Division of Welfare and Supportive Services.
Good morning, this is Ryan Studebaker. I am the other Tribal Liaison for the Division of Welfare and Supportive Services.
Good morning, this is Jesse Jones. I'm the Tribal Liaison for the Department of Public and Behavioral Health.
And I am Breeza Virgin, and I'm the Tribal Liaison for the Division of Healthcare Financing and Policy, also known as Medicaid. Okay, and we will open it up to public comment. Is there any public comment at this time on any topic? I do see a hand. And again, if there's Ace, I believe I saw your hand raised. If you're on a cell phone and a computer, if you just lower the volume completely on one of the devices, it'll get rid of that echo.
Yeah, good morning. My name is Ace Patrick. I only have one device going.
Oh, okay.
But thank you. Good morning. My name is Ace Patrick, and I am the chair of the Nevada Statewide Independent Living Council. And I just wanted to introduce myself and mention that the council is interested in advocating for the Nevada tribal members with disabilities. You can find out more information about us at our website, which is www.nvsilc.com, including our next meeting, our next scheduled meetings. Please read more about us there. And thank you for your invitation today.
Thank you, Ace, for joining us. Is there any additional public comment at this time?
Hi, good morning. This is Raquel O'Neill. Can you hear me?
Yes, we can. Thank you.
Hi, good morning. My name is Raquel O'Neill, and I am the chair of the Nevada State Rehabilitation Council. And I'm here to advocate and talk to you about the potential of having a member representing the tribes join our council. We've had a vacancy for a little while now, and we would really love and respect the input and feedback regarding the tribes in the rehabilitation process. So if you have any interest or know of anyone who would like to join the Rehabilitation Council, I would just ask that you reach out to me directly. I cannot access the chat box from the phone. I apologize for that, but I can make sure to email or get my information emailed to the right person if that's possible.
Hi. Yes, thank you very much. Feel free to email me. I will I'm not sure if you have my email address, but if it is B for boy and then Virgin, VIRGEN at DHCFP for Division of Healthcare Finance and Policy .nv.gov, and I will make sure to distribute that information.
Wonderful. Thank you so much for allowing me to speak today. Thank you.
Thank you. And Augustine, I see your hand is raised.
Good morning. I hope this sounds better than the opening prayer there. Can you hear me okay?
Yes, it sounds great. Thank you.
Wonderful. I just wanted to share that over the summertime, I've become a partner with the Center for Healthy Aging and the Nevada SNAP Ed, and we're in the process of creating a intergenerational community garden in Lemon Valley, and my hope is to create a agricultural space to have a seed dispensary hub specializing in indigenous ancestral foods and plants. We will be ordering from many of the Native American indigenous hubs throughout the country, and we want to be able to share seeds to other Nevada tribes and other community gardens to assist us in propagating these seeds. We hope to create a food hub and seed hub utilizing the current intergenerational community garden and food pantries and farmers markets. And we hope to have a garden plot and during the harvest give freely the harvest to food insecure communities. And so I just wanted to share that. You'll be hearing more concerning that. And once again, I thank Nevada SNAP Ed. And you have a good day. Thank you.
Thank you, Augustine. Any additional public comment at this time? Okay, we will move on to agenda item number 3.
Risa,
I'm sorry.
hold on. There's a hand up. You've got Katie Zeller whose hand is up.
Oh, wonderful. Thank you, Oma. Katie, would you?
Good morning. Can you hear me?
Yes.
Perfect. Hi, everyone. My name is Katie Zeller. I'm an enrolled member of the Choctaw Nation, and I work for the Churchill Community Coalition in Fallon. We're currently working with UNLV, Tribal Minds, Reno Sparks Indian Colony, Stacy Montooth with the Nevada Indian Commission, and we're working on tribal outreach for COVID vaccine awareness. And I also have a lot of masks left, so I understand that, you know, masks are kind of a dying breed, but we understand how essential and important they are. So if there's any organizations who are interested in more information for community members, like flyers, or if you would like any masks or hand sanitizers, please feel free to reach out, because we've got some left to disperse to any tribal community members or entities throughout the state. Thank you.
Thank you, Katie. Any additional public comment at this time? Okay, and I am hearing none. So we will move on to agenda item number 4 with the consultation and updates. We will start off as the Division of Healthcare Financing and Policy. We do have on the agenda our Dwayne Young, who was our Deputy Administrator. Mr. Young is no longer with the Division of Healthcare Financing and Policy. He has gone over to the Governor's Office as Director of Policy. But we do have, I would like to introduce our new Deputy Administrator. I'm not sure if she's on, I believe she's on the call, but it's Dr. Antonina Capurro. And she is our new deputy administrator who's overseeing our policy areas over at Nevada Medicaid. Dr. Caprio, are you available?
Yes, I'm here. Thank you so much for that introduction, Brisa. It's so nice to be with you all today. I do know that Mr. Young was scheduled for one of the agenda items, and Ms. Spearman, our administrator of DHCFP, will be taking that agenda item today, but I look forward to speaking with this group in the future. I'll just be listening in for today.
Thank you very much, Dr. Caprio.
Good morning, Brisa. Would you like for me to jump in with the legislative update?
Yes, please. I would really appreciate that. Thank you.
Great. Well, good morning, everyone. And I'm Suzanne Bierman, the administrator of the Division of Healthcare Financing and Policy. And thank you, Brisa, for making the announcement about Dwayne's new position, and we are thrilled to have Dr. Capiro here, but I will do stand-in today and just provide a quick and brief overview of the legislative session. The Department of Health and Human Services tracked more than 300 pieces of legislation throughout the 81st session of the Nevada legislature. 185 of those bills that were followed by the department did end up being signed into law. So there's quite a large number of pieces of legislation, and I was thinking, Brisa, maybe a helpful thing would be if we could share our departmental legislative summary with this group, and then could come back and discuss any particular bills in greater detail at a future date, just kind of given how many there are, and don't want to take up the full time of this meeting today, but did just want to highlight a couple that impact the division that we're really excited about. Improving maternal and child health has been one of the division's priorities throughout the last couple of years, and there were a couple of pieces of legislation that passed that are going to help advance some of those goals and improve maternal and child health. So we're really excited about providing coverage and reimbursement for doulas and community health workers, and our team is working to implement all the changes to make that happen in terms of state plan amendments and updates to our system that will allow for reimbursement. Also some coverage for those services, and also some eligibility expansions for pregnant individuals, presumptive eligibility, and expansion to undocumented populations, certain lawfully residing undocumented populations that haven't been here for 5 years. So excited about that coverage expansion. And I think that you have a document up here, Brisa, that's not the exact same one that I had. So this is helpful too, but I think it just kind of highlights a couple of the big bills in the maternal health section, which I alluded to, also chronic disease and oral health, Dr. Capiro's background. So we're excited to have her on our team for a number of reasons, but did want to highlight that she brings a lot of expertise in that particular area. And some of the bills that have big impacts are listed on this document here, as well as behavioral health. The 1115 waiver that we've gotten support for is something that we're really excited about advancing, and is going to provide additional coverage and treatment for individuals with substance use disorders. And also the expansion of the Crisis Now model are big improvements to our behavioral health system, and the division is certainly going to be very busy working to implement this legislation over the coming months and years. So there is a lot here, and we can share this document as well as a kind of a more comprehensive document that we have as well. Also happy to pause and see if there are any particular bills here that anyone has questions about, or just maybe going forward after everyone's had a chance to look at it as a continuing agenda item. We'd be happy to come back and provide additional information and implementation updates. So thank you, Brisa. Thank you, everyone, for the opportunity to be here today.
Thank you, Suzanne, for sharing that. I really appreciate that. And again, if after this meeting anyone has, or even during the meeting, please feel free to ask any questions in the chat, or please feel free to unmute yourselves at this time if you have any questions or comments for either Suzanne, our administrator, or Dr. Capurro, our deputy.
This is Homa. There is a question in the chat from Marta Jensen asking about how documents will be shared from this meeting. Correct me if I'm wrong, they'll be posted on the Medicaid website, where you can also find the agenda and any materials from before the meeting. If anybody needs anything specifically emailed, then they can email Breeza, and she can get those documents or that information over as well.
Yes, that's correct. Thank you, Oma. And we also do send a follow-up email to all of our tribal contacts that we have on our listserv. If you'd like to be added on that listserv, please feel free to email me or Crystal Baselli as well, and we can add you to that listserv. And we tend to follow up after these meetings with all the material that was used during the call to share as well. And again, I will put my email address on the chat. So again, please feel free to email me with any follow-up questions, comments, or anything with regards to any of the legislative bills that DHCFP has been is following up on. Okay, and to continue, next on our agenda, we do have the preliminary discussion of proposed meeting title change, SurveyMonkey meeting location, so virtually versus Microsoft Teams and in-person suggestions. This is on our agenda discussion back in April as well, and this is an effort that we've been working with the Nevada Indian Commission, which has been great to partner with, to really look at our current practices on how we host these tribal consultations, and really in an effort to improve them and to make them really, what tribal members, what our tribal leadership, tribal health directors, what would best fit your needs, and how you would like these to be ran. And so again, there is a survey that was put out a couple weeks ago. We did email that out to everyone on our listserv. Please feel free to I will also send out that same email at the end of this meeting to everybody again. I've also included in the chat the survey, and I am including it one more time on the chat, the link to the survey. It takes about 2 minutes to fill out. It's about 6 questions long. And please feel free to take a moment to fill out that survey either during this call or after. It would be much appreciated. And again, we just welcome everyone's input to be able to improve these collaborative meetings. We really want to be able to make these meetings what fits best for all of our for all the tribal nations in Nevada. So again, please feel free to take a couple minutes to fill out that SurveyMonkey. I will send it out again at the end of this call as well. Based on this survey does close by 7/16, which is this Friday, by 5 p.m. So we'll close at 5 p.m. on this Friday, July 16th. And at that time, afterwards next week, we will look at all the survey results, and we will, at the Tribal Health Directors meeting in August, we will then meet with all of the tribal health directors and review the survey results, and then also I will send out follow-up emails with tribal leadership as well, so that everyone knows what the results were as well. But again, this will help us greatly, improve upon these processes for consultations. Thank you. And next on our agenda, if there's no questions about this topic specifically, we'll move to the next agenda item.
Breeza,
Yes.
is Priscilla. It looks like Katie Zeller might have her hand up. I'm not sure. Oh, never mind. She just put it down.
Okay, thank you. Okay, so next on the agenda, we have behavioral health policy updates. And this is presented by Sarah Dearborn, our unit supervisor in the behavioral health unit at Medicaid.
Good morning, everyone. Thank you, Breeza, and thank you, members of the tribes, for having me present on our behavioral health updates. I will try my best to do this quickly. There are quite a few that I want to talk about. Also, I'll be providing some more specific updates related to the 1115 waiver that Suzanne had previously mentioned as well. But first, at our last tribal consultation meeting, I did present on a couple of the state plan amendments that we did have under review. I'm happy to announce both of those have been approved. So the state plan amendment for our newest 1915I home and community-based services option, and this is in regard to youth that are in specialized foster care. The state plan amendment was not for the services within the 1915I, but the amendment was to include an additional care coordination model known as safety assessment family evaluation. This model is utilized by the local county agencies and will be used to help determine youth eligible for these 1915I services. So that state plan amendment was approved on June 8th with an effective date of July 1st. So what we are doing now is we are currently working on implementation and enrolling providers into this new provider type. That is provider type 86. And we're also working with Dcfs and all of our county agencies as well. So everyone is on the same page and up to speed on what the enrollment process looks like, what eligibility for these services looks like, as well as the assessment process. So we are excited to get that moving along. Also, state plan amendment for medication-assisted treatment for opioid use disorder was also approved. That was approved on May 26th. This state plan amendment did not have to do with any new policies or any new medications or services related to medication-assisted treatment. It was really just a requirement from CMS that indicated they would like a certain section dedicated to medication-assisted treatment for opioid use disorder within Nevada's state plan. So that is now publicly posted on our website as well. And it is very helpful. It's a very helpful resource to go to see the types of providers that are able to perform medication-assisted treatment for opioid use disorder, as well as the required covered medications for that service, as well as the behavioral health services that support that service. So those are approved. Moving on to the recent submissions for state plan amendments. So we did, at our most recent public hearing in June, we were able to submit a state plan amendment for our CHIP state plan. And this is kind of similar to the medication-assisted treatment. This is not any new services being covered. This will outline within our separate CHIP state plan all of the behavioral health services that children that are covered through CHIP can receive. Also, additionally, the state plan for attachment 4.19-B, pages 3B and 3G, were in regard to the elimination of biofeedback and neurotherapy services for the treatment of a mental health diagnosis. Neurotherapy is an individual psychological therapy incorporating biofeedback training combined with psychotherapy as a treatment for a mental health disorder. The elimination of these services is being made as a result of the approved Division of Healthcare Financing and Policy budget during the 2021 legislative session in effort to reduce costs to the Medicaid program and to address the governor's mandated budget cuts. So again, the state plan amendment is really to finalize that last step that was approved within our budget during the legislative session. I will pause there briefly for any questions related to any of those state plan amendments.
If you have any questions, please feel free to unmute yourselves at this time or raise your hand.
Hi, this is Carrie. I was wondering, where can I get more information, like written information about these amendments?
Carrie, I'm happy to provide some more specifics, but the state plan amendments, you can also go to our Nevada Medicaid website and view kind of the details of the language edits in the public notices section. So all of the drafted edits to all of our Medicaid services manuals, as well as our state plans, there should be copies of those next to the agendas for each of the public meetings. Does that help?
Yes, thank you so much.
And also, Sarah, if I can add, we also send out to all of our tribal contacts, to all of tribal leadership or council, chairman and health directors, we send out a, I apologize. We send out to tribal chairman, and also to ITCN, we send out tribal notification letters of any state plan amendments that we do, and also of any Medicaid service manual updates that we plan on doing as well. And those are also shared on our, sorry, Sarah, those are also shared on our dhcfp.nv.gov website, and I will go ahead and pull up the direct link to it, and I'll put it in the chat box as well, so you can click on that and see all the tribal notification letters that have been issued thus far. And that's where we post them after we issue them as well. And I'll post that in just a minute on the chat box. Thank you, Sarah.
Yeah, thank you, Brisa. It looks like Andrea Johnson as well has a question.
Hi, this is Director Harper from Reno Sparks Tribal Health Center. Sarah, when you talked about the neurotherapy budget cuts, what are resources that the tribes can go to for those services that are being removed? Are there additional resources?
So there's several other behavioral health services that are still available. So all of the regular psychotherapies are still available. As part of the budget, the neurotherapy and biofeedback for the treatment of a mental health diagnosis was the only mental health service that was removed, but all other services are remaining. So if you need support or access to more knowledge about what kind of service arrays are available for individuals, I'm happy to help link you to all of those as well.
Okay, thank you.
Sure, and after I'm done presenting, I'm happy to put my email directly in the chat as well. Okay, great. So moving on, I did want to just present a little bit on our upcoming 1115 demonstration waiver. So as Administrator Bierman had indicated, Senate Bill 154 was recently approved in the legislative session, and this Senate bill requires Nevada Medicaid to apply for an 1115 demonstration waiver. So the division will be applying for this authority with CMS. The authority asks for a 5-year Section 1115 demonstration waiver to expand statewide access to comprehensive behavioral health services for our most vulnerable Nevadans, including those with opioid use disorders and substance use disorders. Nevada is requesting this authority to provide enhanced substance use disorder benefits and a limited waiver of the federal Medicaid institutions for mental disease exclusion. Also, as a reminder, an institution for mental disease is defined as a hospital, nursing facility, or other institution of more than 16 beds that is primarily engaged in providing diagnosis, treatment, or care of persons with mental diseases, and also provides for medical attention, nursing care, and related services. Federal law currently prohibits states from using Medicaid funds to pay for services provided by an IMD to individuals between the ages of 21 through 64. The 1115 substance use disorder demonstration option will allow Nevada to test full coverage of substance use disorder treatment service array, which includes IMDs, in the context of overall substance use disorder service delivery transformation. So that was quite a mouthful. Just to kind of simplify what we will be requesting within this waiver, the enhanced benefits that we'll be able to include in this behavior. First, the division will request this waiver related to, again, substance use disorder treatment. So it's going to be the facilities that currently are providing that substance use disorder residential treatment service array. Those ASAM levels of care are levels 3.1, 3.2, 3.5, and 3.7. So again, those are all those substance use disorder treatment residential types of levels of care, as well as withdrawal management services. Also included in these enhanced benefits, we've done a lot of work around developing the specifics of this waiver, and we've engaged providers that currently provide those levels of care in some design sessions to really identify, what they're seeing and where services that they feel would be beneficial as part of this waiver. We've really been able to identify that a specific population within these treatment levels of care would be our pregnant and parenting individuals that are in need of substance use disorder treatment. So a couple of the things that came up as additional services to hopefully include in the waiver were case management services for adolescents and adults with a diagnosis of substance use disorder only when provided in an IMD setting. As well as another benefit that has come up is the supervised transportation. So when a pregnant or parenting individual is receiving the substance use disorder treatment, it's also crucial that they continue to attend their other medical and social service appointments as well. So we recognize that possibly including a supervised transportation type of benefit within this waiver would be needed as well. So we are hoping to, the timeline is fast approaching, so we are hoping to get the application submitted to CMS at our August 31st public hearing. So we will be, right now we're currently working on finalizing the application of the waiver, and we'll be able to get that posted hopefully by July 29th to allow for that public comment. And please, we definitely invite any public comment on this. We want to make sure we get it correct with CMS. We recognize the process is going to be a lot of back and forth with CMS just to make sure we get what is needed in there. So we appreciate any public comment on that. Also, I wanted to provide a couple quick updates on our Support Act planning grant. We have really been able to move this waiver process forward with the support that we've identified with our Support Act planning grant. So the Support Act Planning Grant team has completed our final review of the Support Act strategic plan. We completed that in June. This is our plan that DHHS will use to guide DHHS over the next 5 years to continue to improve substance use disorder provider capacity. This report will be reviewed by CMS and prepared for publication. So again, once it's approved by CMS, then we'll be able to publish that for the public as well. The strategic plan was based on our infrastructure assessment report that was completed in August of 2020, which identified some gaps in the substance use disorder provider capacity in Nevada. The next item is to complete our sustainability plan, which is in final review. And this identifies the lead entity, key partners, ongoing investment, and timeline for the approved tactics to sustain workforce capacity and funding. Next, we'll be able to begin developing a Nevada substance use disorder data book, which will monitor future substance use disorder trends, utilization, and capacity. The Support Act Planning Grant does end on September 30th, but there is an opportunity for a no-cost extension for 12 months, which Nevada will be applying for, as this will permit Nevada to employ the Support Act Grant data analyst for an additional 12 months to continue to develop the substance use disorder data book and produce quarterly updates, as well as continue with other substance use disorder data analytic responsibilities. Also, the planning grant does end in September, as mentioned. The Section 1003 Support Act Demonstration Grant application notice of funding opportunity was released in July 9th, which will complete during the next 45 days. CMS will be able to only choose 5 of the 15 states that were originally awarded the planning grant, and this award will be announced in September of 2021. So we are working diligently on that. We have high hopes to hopefully receive that next phase of the grant as well. Moving on just to some new projects that we're doing within our behavioral health unit. These are in regard to our Medicaid Services Manual updates. So our first Medicaid Services Manual update is for Chapter 3800, which is our Medication Assisted Treatment chapter. And these are to align with the new buprenorphine practice guidelines that were published by the Department of Health and Human Services that, among other things, will remove a long time requirement tied to training, which some practitioners have cited as a barrier to treating more people. These revisions include updating exemption language related to training, counseling, and other ancillary services for providers prescribing to 30 or fewer patients. We've also added annual reporting requirements for qualified providers approved to treat up to 275 patients. Also, and I apologize, we're proposing those updates at our July, I believe it's 27th public hearing. And so that is posted on our public notices website, so you can go in and see the edits to the chapter there. Also, we'll be hopefully moving forward with some additional Medicaid Service Manual updates for Chapter 3700. So this is a result of the legislative audit AB 174 from our 2019 legislative session. DHCFP is proposing changes to Medicaid Services Manual Chapter 3700, Applied Behavioral Analysis. This audit is in its entirety can be found at the Legislative Audit Division website, and we're happy to put that in the chat as well if you would like to see the full audit there. So as part of the audit, we'll be proposing some MSM updates. Some of these changes will include for our provider type 85, which is our applied behavior analysis provider type, as well as our school-based services, which is provider type 60, that these are the only two provider types that will be able to bill and perform services for applied behavioral analysis codes. Additionally, we will be recommending that the NPI for group providers for applied behavior analysis services must be unique to that group. Also, the only providers that will be allowed to link to an approved applied behavior analysis provider type under PT 85 are the specialties that can provide applied behavior analysis. So those specialties are a licensed behavior analyst, psychologist, licensed assistants, behavioral analyst, and a registered behavioral technician. Also, including updates within that chapter will be just some clarifying language on progress note requirements and documentation standards. A lot of those progress note requirements will kind of mirror what we also have as documentation requirements within our Medicaid Services Manual, Chapter 400. One Senate bill I also wanted to bring up was Senate Bill 96. And this is also in regard to our applied behavior analysis. So this Senate bill does make some various changes relating to services provided to persons with autism spectrum disorders. And this has passed and will increase the rate for the registered behavioral technician to $52 an hour. So the division will be working on moving that forward as well. I believe that will come a bit later. I think the implementation of that, I apologize, I've got a lot of documents pulled up here, is July 1st, 2023. And I think that is about it for our behavioral health updates. Are there remaining questions?
And I know Sarah had a lot of information to cover, so I do want to add that that's why we record these, because we do include all of this information in our meeting minutes. And also, I'm just going to share my screen real quick so that you can see where it is that you go to be able to see all the tribal notification letters. So again, any state plan amendments, any Medicaid service manual policy updates, or proposed language changes, we do send out, or any waiver applications even, we do send out tribal notification letters on to all of tribal chairmen. And so again, that is located, and it's also posted on this website. So you're able to see this website. And I did share the link to this website on the chat as well.
Thank you so much, Breeza. I'm also going to put in the link for the legislative audit that I referenced. I will put that in the chat as well. And thank you so much for putting my email in, as I recognize that those were a lot of updates. So I'm happy to answer any questions or specifics anybody else had as well.
If there's any questions for Sarah, please feel free to unmute yourselves or raise your hand at this time. All right. Well, Sarah, thank you very much for joining us again.
So much, Breeza.
Okay, and next, next on the agenda, we have Anthem Blue Cross Blue Shield Healthcare Solutions Benefits and Coverage. Olivia Smith with Anthem Blue Cross Blue Shield Healthcare Solutions Community Outreach Manager.
Good morning, everyone. This is Olivia Smith. Thank you for having me, Brisa. I'm going to share my screen here in just a little bit. Please stand by. I'm not very techy. 1 second. Okay, can you see me?
Yes, we can see the PowerPoint. Thank you.
Awesome. Thank you so much, Brisa, for this time. My name is Olivia Smith, and I'm the Community Outreach Manager for the Anthem Medicaid Division. And so I just want to go over and introduce ourselves, myself and Angie. And Avisca is up in Reno, the Washoe County area, and I cover Clark and Washoe, but mostly in the Clark County area. Okay. So this is for today. What we're going to go over is who we are, who we serve. We promote the whole person health, Nevada, and also we have the Anthem, the Nevada Anthem Foundation, and how we support the community and provider support, filling some of the gaps in the care, and then our marketing team. There's Angie right there. There's my girl up in Washoe County. Who we are. We are one of the 3 health plans who offer managed care in Clark and Washoe counties. Each year, we continue to grow and serve more people in the need across Nevada. So we cover anything from the homeless members all the way to the pregnant moms, different community programs also that we're involved with. And there I am in the black shirt. This is that's with Roz. She's with Vegas Roots, and we sponsored her urban garden in the historic West Side. So we serve, who we serve, we help provide access to healthcare for over 258,000 Nevada Anthem members through the Nevada Medicaid, who are eligible from 18 to 64 years old, and also the Nevada Checkup covering members from 0 to 17 years old. We work closely with our Medicare team. So when we have the members that are aged out to 65, coming to 65, we usually work with the team so that way there is a continuum of care for the Medicare part for the Anthem HMO. Okay. So the next one is promoting whole person health. The whole person health includes the physical health, BH, emotional well-being, and all other factors that contribute to an individual's wellness. We support the whole person health in our communities by offering a large selection of top doctors. So usually what we do is, like for me, if I run into a member or they'll email me, hey, Olivia, I need a doctor in 89106 primary care. Can you help me with that? I either go on our portal and then, or I usually have transfer them to our customer service call center, which we have one here in Las Vegas. Okay. Supporting social determinants of health, SDOH. So we invest in education, employment, the housing, homelessness issues, social justice, transportation, health equity, and more. We have, my role has changed a little bit in regards to doing the tabling events. I still do the tabling events out in the community. It's more of a program development. So for example, with the reentry on the social justice, right now we work with like NDOC and the parole and probation, all of the jails in Washoe and Clark County. Participating in community outreach, we build a strong relationship with our members and their communities by holding fun educational events that promote access to care. So right now, we are involved with a lot of back to school events and trying to drive the COVID vaccinations with some of our partners, to include some of the FQHCs. The fire department here in Vegas is helping with that. And we're sponsoring a lot of these COVID shot clinics. Okay, oops, I apologize. One more. Serving on boards and committees throughout the state, we strive to give a voice to our members and our partners. We have our hands in a lot of coalitions and different boards. So up in Washoe County, I know that like Angie is involved with the Nevada Housing Coalition. And I also go into the meetings for the Maternal Child Health Coalition here in Clark County, actually for the whole state. It covers the whole state. And then I sit on different other different boards that help with the underprivileged communities also. Okay. Next one here. We award grants that promote healthier families and communities in Clark and Washoe counties. Here are just a few of the organizations and programs that we have funded. So the first one, this was really important for us. When COVID happened, we had planned. So the COVID happened in mid-March, and with all the kids being schooled, homeschooled at that time, we knew there, because of the population that we serve, we knew there was going to be a challenge of the internet access and just the teaching component, teaching in regards to the kids having access to the classroom setting, that kind of stuff. So we actually we partnered with the Harrison House and some of the other partners in the historic West Side, which is more of mostly the BIPOC community, and we funded the free Wi-Fi access for the entire 89106 zip code. So that's been going on for like almost a year now. So we funded the entire program, the entire project. Next one is the Nurse Family Partnership. We love this program. This was a partnership with the Southern Nevada Health District. So we created a program with them for strengthening family, using the milestones that the health district used, and then we sponsored the program to help the families in some of the other needs that they might have, say like a car seat, for example. Okay. So Boys and Girls Club, definitely we love this program throughout Clark and also the Washoe County. So we pay for 5 through 14 years old for the Anthem Medicaid members. And I actually get the invoice every month to, help with that. So we love that program because it's health and wellness related, mentorship. They got the tutoring piece component, also the healthy snacks. The temporary housing program, so that's in Clark and Washoe County. Up in Washoe County, we went in with Hope and the Hope Clinic and for the tiny homes up there. And also down in Clark County, it was the Healthy Living with the help of Southern Nevada is what we went in with. And also we work with Clark County Social Services. Employment Readiness Program. So we have a Clark and Washoe County. So down in Clark County, we partner with Future Independent Tomorrow. Right now I'm working with the Nevada Workforce also to, with their IT program, especially their IT program for the youth. And, but it's been going really good for us. Next one is some of the community support we have. So that's my other colleague, Terry Moss. He is our RV driver. And so we go out and we support anything from baby showers to food bank, all throughout Washoe and Clark County. So 3 Square is one of our major, of course, food distributors for Clark County. Every year we definitely, actually not every year, but pretty much every quarter, we go, I try to get with the Anthem Foundation to see how we can support 3 Square because they fall under Feeding America. Also, because the food insecurity is so bad. It's so bad in Nevada. So we recognize that, and we focus that since COVID. COVID actually just exploded the food insecurity piece of it. Volunteers of America. So Angie works with volunteers, VOA is what we call them, with the Project Restart in Washoe County. Catholic Charities, that's going to be for Northern Nevada. She has a very, very good relationship with them for the food supplies and other emergency needs. And again, I discussed about Future Independent tomorrow. Women's and Children's Center of Sierra. I love this program. So that's up in Washoe County with Angie, and we support their diaper bank and some of their essential needs, their ESL program also. Baby's Bounty, wow, lots of diapers with them that we go through with their diaper bank. So we fund them through either marketing or the Anthem Foundation for that, because the need is so great, especially in Clark County. All right, so the next one is, oh, there I am with Terry with our RV. So our provider support, Community Health Alliance, CHA, Angie has attended where they were doing a sponsor, trying to raise some funds for the undocumented, so that way we can help them, with not the sliding scale, but the cost of healthcare whenever they go to CHA. First Person Care Clinic. We've given that, they actually have an in-house food pantry at the FQHC, so we support them by giving them the tote bags. Silver State is another FQHC. We go out with them also for vaccination campaigns. With them, usually I do the back to school stuff with them, and the sports physicals for the kids. And then Mexican and El Salvador consulates, that's locally here, but they cover the entire state. We work with them from HPV education to sponsoring their flu vaccination. We've done that with them. COVID testing, we've done that with them. We partner with them also. Hope's Clinic, I discussed that with the Tiny Village, and that's up in Washoe County. All right, next one here. Some of the ways we fill the gaps in the care. So for whole person care is more than what a member receives at a doctor's appointment with Anthem. Members programs and value added benefits, which is done every year. We renew that every year with the state. We help the members work toward a whole person wellness, and here are some of the items that we do with them. Okay, so for example, the eyeglass, we have that up to $100 per year. And then the Weight Watchers, we give them the vouchers for that. Disease management, we offer support and education program from anything from asthma, diabetes, and COPD. Also, that's not on here, we have a smoking cessation program also, which we refer that to one of our partners for that. And we actually have a case manager that follows that member to make sure the member has all their needs met. The Fitness Coach app, this is new. With this app, the services include online exercise classes and online information on fitness and exercise topics. Lots of different apps that we have for our members. Some additional ones here is the GED testing. So I handle that. So if you know of anyone that is an Anthem member that is needing a GED done, please email me, and I'll take care of that, because they have to have a voucher number. Dental hygiene kits, we have that through the customer service, but that is actually part of our marketing that when we go out, do the tabling, depending on where we go and what the event is, and we'll bring out the dental kits and toothbrush. Free Costco Gold membership. We did this we rolled this out last year, and it has been so popular with our members. And we did that for more of like the bulk buying for like the diapers, for example. So, and also we open it up in case. So what we run into is, for example, an undocumented mom. So the mom will have Medicaid, but the Medicaid will be expired once the baby is born. So, but since the baby is Anthem Medicaid, then the mom can actually apply for the Costco card in for the baby. That's why we open it to all. And also what we have seen is for the reentry population. So the kids, you know, some of the kids will go to other family members because the parents may be in prison or jail, or so that's why, you know, as long as the legal custody is with the family member or whoever it is that has the legal guardianship, they can actually apply for the Costco card for the member. Cell phone, free cell phone, 350 minutes through SafeLink, and 200 extra one-time bonus when they choose to get free health text messages. And also if they are enrolled with our case management also. And the Anthem Medicaid Mobile, our app for smartphones, allows the members to safely access their ID card, find a doctor, explore health and wellness information on the go. Okay, so the next one here is behavioral health. We have a new app called My Strength. So this app is a tool to help with the depression, anxiety, stress, and misuse of drugs and the alcohol. And we have the inpatient and outpatient BH services also. Okay, this actually happened to me. One of the nurses that was out in the field, and I ran into her through the health district, and she actually had a postpartum mom, and the postpartum mom was Anthem Medicaid member, and so I referred her to our BH case manager to help her and to get the referral done, so that way she can get the appointments with some of the BH providers. Okay. So just for the kids, again, we have the Boys and Girls Club. This is actually 5, right now it's 6 to 14, but up in Washoe is 5 through 14. But the Clark County one should be changed back to 5 through 14 because all the kids are going back to school. Sports physicals from 7 to 18 also. Oh, there I am again. All right, we love the WIC program. So for the pregnant moms and the members and the mothers. So we have the program, which is the new baby and new life program. So they actually get, if they're in a healthy pregnancy, they actually can make up to $75 in rewards for the doctor's visits for preventive medicine. Children's books also that can actually go through the portal. Again, the tobacco free on the Baby and Me, that's going to be for the $25 vouchers for the diapers and wipes, and then the baby car seat. We rolled this out this year, and this is going to be for the moms, pregnant moms up to 12 months. 12 months old, and that's per pregnancy. So they actually can go through their member portal and request for a car seat. Okay. Here are some of the, so what we did last year was we rolled out a breast pump as part of our value added benefits. So these are some of the models that they can actually order through Medline for breastfeeding. So Angie, here we go. Angie covers Washoe County, and Olivia, Terry, and Angelica, the 3 of us are in Clark County. So Angelica is also bilingual. We love Angelica, and Angie is also bilingual. So here's our contact information if you ever need to get a hold of any of us. Like I said, I cover the whole state. So if you ask me, hey, I don't remember what Angie up in Washow's email is, please reach out to me and I'll get that information to you. So thank you again, Risa, for allowing me to give the presentation.
Thank you very much. I really appreciate that, Olivia. And again, this presentation is actually included in, it's attached in the, where you can find the agenda under public notices under the DHCFP website. So that is attached, that is included on that. And we will also make sure to include the link where you can access that PowerPoint as well with the follow-up email after this. I will go ahead and share the agenda again. The next, are there any questions currently for Anthem, for Olivia, before we move on to the next agenda item? Okay, and I hear none. So the agenda item is the Division of Welfare and Supportive Services with some 2021 legislative updates. We have Yvette Collin and Ryan Studebaker.
Hello. Ryan, did you want to cover legislative updates, or did you want me to speak about outreach before you did that?
Go ahead and take care of outreach because I have a kind of a long list to go through.
Okay, so good morning, everyone, and thank you so much for coming to consultation, attending. I just wanted to speak quickly about our targeted outreach partnerships program, which is going to expand within the next year or so. So right now I have tribal health clinics throughout the state that we service directly with eligibility personnel. And as of the last session, we were told that we could expand the program. So I would like to speak out to any tribal health directors that are on this consultation. If you are interested in having the Division of Welfare and Supportive Services service you directly, and it can be done virtually. We do reach out to Fort McDermott once a week, and we speak to them virtually this way and service clients and make sure that we offer them all of our programs. So if you're interested, I'm going to put my email in the chat. I do oversee the program, and I have a heart for the tribal community and the rural and the frontier community all throughout the state. So please contact me if you are interested in having the Division of Welfare and Supportive Services involve you in our targeted outreach partnerships program. And most of our services were virtual throughout COVID. We are now finally deploying all of our people back out into the field. Again, if you have any questions or need anything from this outreach program, please shoot me an email or a call. I will put my information in the chat. And other than that, I do not have anything concerning outreach for DWSS. Ryan, I believe you are up.
Thank you, Yvette. Good morning, everyone. Ryan Studebaker with the Division of Welfare. I am going to go ahead and share my screen here real quick, just so it's easier for you guys to follow along with me. The Division of Welfare, okay, would help if I could find my document. The Division of Welfare has been monitoring a few of the legislative bills that went through this session, and some of them apply directly to eligibility or create changes in eligibility. And for us, two of the biggest bills that affected eligibility for Medicaid is AB 189 and SB 420. Those bills kind of go hand in hand. They are almost identical. There is a few differences between the two. So one of the changes in AB 189 and SB 420 is presumptive eligibility for pregnant women. Now, what this will do is similar to the hospital presumptive eligibility program. This will allow qualified doctor offices to approve eligibility for, excuse me, qualified entities, not necessarily doctor's offices. It could be other facilities that don't meet the hospital presumptive eligibility requirement. And it will allow these entities to approve prenatal presumptive eligibility for pregnant women for up to 2 months. And it'll allow them to receive the services they need. We are looking to implement that no later than July 1st of next year. However, that is an estimated date, and we are working to maybe move that up as best we can. In addition to that, in AB 189, we also had Medicaid eligibility for the lawfully present pregnant women. Similar to the children we cover under CHIPRA 214, these pregnant women who are lawfully present in the country who do not meet the 5-year bar will now be eligible for full Medicaid, and as long as they meet all the other factors, of course. And just like the PE, we're looking to implement that by July of next year. Senate Bill 420 goes on to increase the income limits for qualifying a pregnant woman. It's also looking to add a public option for medical insurance, and I'm sure the exchange will talk about that later. SB 109 is a change in the demographic information that's collected by DWSS. It's going to require us to gather additional demographic information. We're going to expand on our race and ethnicity questions to include more specific information, not just the general categories we use now. And including in that would be gender identity and sexual orientation. And there are various reasons for that reporting and ensuring that benefits are provided to all these various populations and to identify that. Okay, SB 5 is the creation of a telehealth dashboard. And that I believe we're going to work with dhcfp and the other DHHS agencies to create that dashboard to allow for the easier communication and access to information. AB 358 is suspended Medicaid changes. And what that more or less does is allows an individual who is pending release to apply for and be approved for Medicaid prior to release and placed in a suspended status. That way, upon release, they can easily be transitioned with a minimum break in coverage, or as least amount of gaps in that coverage from the time they're released so they can get or receive assistance or benefits. Those are some of the major bills that we're looking at. Some of the other program and policy changes that are going on currently with the agency. The Consolidated Appropriations Act signed back in December added COFA migrants who were previously denied Medicaid as a non-qualified non-citizen. COFA is the Compact of Free Association. This is an agreement that the United States went into with several Pacific Island nations, and now those migrants are eligible for Medicaid. We're also looking to expand our current systems to include an instant eligibility system. This is a tool to help our staff process cases even quicker. It provides access to a lot more electronic data than we're currently using, and overall it should benefit individuals applying, and they wouldn't be requested to provide as much information as they need to in today's world. Getting down to the SNAP program, there are a few things coming up for SNAP that I'm sure everyone is interested in. The first of those is the Pandemic SNAP program. Basically, SNAP benefits for school lunches for the 2020-2021 school year. That's going to be broken up into 3 separate monthly issuances for the entire school year. And those issuances will begin going out to families with qualifying children in September of this year. And it'll be for 3 months. So it'll be September, October, November. We don't have specific dates for the actual issuances, but those are the months that you can expect to receive those. In addition to the school lunch for the past school year, we also have Summer SNAP or Summer EBT where we're issuing benefits for the children for the summer months of June, July, and August. That issuance is looking to come out sometime around December of this year to qualifying children. And then we just were notified on supplemental SNAP. For the last several months, DWSS has gone and issued what we call a maximum SNAP benefit to qualifying SNAP households. This benefit usually comes the month after. So if you were on SNAP in May and you got a reduced amount, in June you received the supplement, which increased the SNAP benefit to the maximum for your household size. So that is a benefit that's approved by FNS. And so July has been approved for max benefit. That'll come out next month in August. Again, specific dates are not known at this time. So if you are on SNAP in July and you did not get the maximum benefit, expect the supplement next month. And those are some of the major things that DWSS is working on as far as eligibility changes and program benefits. I will open it up to anyone who may have questions. We're here to provide you with whatever information we can.
Please feel free to unmute yourselves at this time or raise your hand if you have any questions for Yvette or Ryan.
Ryan, this is Donna Brown. Can you hear me?
Yes, ma'am.
Hey, Ryan. So I'm not sure if this is a question that would go to you, and I don't think it's really regarding any of your updates. So not that I didn't pay attention to your updates, but I have a question. So we had a patient who had been on Medicaid and got a notification due to her household income. She was going to go off, say, at the end of April. And she was totally fine with that because I think her husband had gotten private insurance. So she was good with that. And then about 2 or 3 weeks after she got that initial notification, she then got another letter saying that due to COVID situation, her Medicaid was going to be extended for another 6 months. Those letters had gone out to clients. And so in the meantime, she had just gotten a referral from our clinic that she was pregnant, and we were getting ready to schedule her with an OB. However, that extended Medicaid coverage kind of screwed her up. And for a good 3 months, we couldn't get her into a provider because they just didn't accept Medicaid and they wouldn't take her private insurance. It just turned into a big mess there. But is there any way when that had happened that, because she tried to ask if she can terminate, and her Medicaid, and our health benefits worker was told that she could not. So what could we have done in that situation, or is that something that was just it is what it is?
No, absolutely not. Medicaid eligibility is not a you must take it kind of thing. If the system, I would be interested in knowing who told her she couldn't withdraw from the program. You are more than welcome to terminate assistance at any time by contacting our customer service unit, reaching out to Yvette and the outreach team, or even contacting me directly. We can always do that. That's always an option for the individuals.
Okay.
Now, the fact that she was extended, maybe I should go into that just a little bit about the pandemic coverage. During the pandemic, the Division of Welfare has not changed the way we do our redeterminations. So basically, everyone that's on Medicaid gets an annual review, and that RD packet is generated and mailed out to all the households when their time comes up. Now, that packet is mailed out 60 days early, so that's 2 months early. Now, what happens is, if your packet is due, say, by July 31st, by July 5th, if we haven't received your packet back, we will go into the system and extend your eligibility because of the pandemic. Now, as of today, the pandemic declaration ends July 22nd. However, we were notified that it's supposed to be extended through the end of the year, although the official declaration to extend it past July 22nd has not been made yet. So we're kind of waiting for the Secretary of HHS to make that extension. In the meantime, on July 5th, DWSS will go in there and we will automatically extend all of the households that were due to end on July 31st. We will push them out another 6 months. And what happens you will receive technically 2 notices. The first notice is going to tell you that if you don't turn in your packet, your coverage could end, et cetera, et cetera. And then on or around the 5th or 6th of July, you'll get another notice saying that due to COVID, we have extended your eligibility. And that is all part of the normal process with the way that it's done. If we were to make changes to our normal process to not send out that first packet, then it would create, when it comes time to unwind from the pandemic, it would be even harder to get people back into reapplying. Because right now, if an individual gets that packet and they turn it in to us, a worker will evaluate that case and approve it for 12 months. So that same packet that comes back on July 1st will get approved, and they'll be approved through July of next year. But if that packet doesn't come in, we're only going to push them out to December of this year and do it all over again in December. Now, should the pandemic end sometime between July and December, then the December notice that you get saying your benefits will end is going to be the only notice you're going to receive. You will not get the COVID extension letter, which means if the households don't respond to that December letter, then their benefits will stop and then they'll have to reapply and go through the whole process all over again, which we're trying to avoid. So we suggest that if anyone receives a redetermination packet or their annual renewal packet, that they do complete it and return it to us so we can give them a full year of eligibility and not have to deal with the COVID extension or anything like that. We'd rather process a case normally instead of having the system push it forward. Now, in your situation, again, if the individual did not want to be on Medicaid and was extended by the COVID push, then she is more than welcome to contact DWSS, by any means, customer service, calling a district office directly, reaching out to outreach, or having yourself contact me through the tribal liaison list. That's all fine ways to contact us. We will then process her request to withdraw that application or withdraw her eligibility, and we will shut down that case for the next month. Why anyone would tell you that she can't, that's not
Cool.
that's not the way it works.
Right.
We
Okay. All right. So I'm
can't
gonna,
terminate
yeah, I'm gonna
because
go.
we're mandated to continue because we can't terminate somebody unless it's for very
Right.
specific reasons. And a withdrawal is one
Okay.
of those reasons. Sorry,
Okay. Well, I
long-winded
think I'll go
answer.
back to my. That's okay. Go back to my health benefits person and just kind of get a little more background on it and see, who she had talked to, that kind of a thing. And so we may be reaching out to you, Ryan, here. Thank you.
That's fine. I'm here for you.
Donna, I'm
All right,
sorry,
thanks.
I'm gonna jump in.
Yeah.
Did she talk to April about this case?
I'm not sure if she talked to April. She talked to one of my health benefits, started there with Deidre, and Deidre had followed up with that. So I'm going to find out who, and see, April just popped into my head too, that we could have talked to April directly. But I'll find a little more details on it and get back with you guys to see where we are with it. But she has gotten into an OB provider, an OB doctor, so she's on her track there. And I think we kind of just let it rest for a while. But I'll follow up and get a hold of you guys.
Okay. Thank you, Donna.
Okay.
Thank you.
Thanks.
Are there any additional questions for the Division of Welfare and Supportive Services at this time? Okay, I'm seeing none.
Wait, this is Hama. I just wanted to relay that Administrator Bierman, when she spoke about AB 189, she misspoke about sort of the categories. So if you were listening earlier when she mentioned the bill, rely on Ryan's summary, and then if it ends up in the minutes, we'll just correct where she misspoke. I know she was concerned that that was on the record about the category of individuals covered. So I just wanted to throw that out there.
Thank you, Oma. Okay, and I'm seeing no more questions or comments. At this time, we will move on to the Silver State Health Insurance Exchange. And we have Tiffany Davis, the tribal liaison for the exchange, with us.
Yes, good morning. Thank you, Breeza. This is Tiffany Davis for the records. Again, tribal liaison for Silver State Health Insurance Exchange. And I apologize, I do not have a nice document for you all to look at. That got by me, so I apologize for that. So bear with me on my updates. There's two major legislative bills that are going to have some impacts on us. And this information is coming from my Chief Operations Officer and Executive Director, some notes that they had for me to give to you all. Two important pieces of legislation that the exchange followed closely that are going to have significant impacts on us. One is AB 432, and the other is, like Ryan mentioned, SB 420. AB 432 will designate the exchange as an automatic voter registration agency, setting up requirements for such an agency to transmit certain voter registration information to the Secretary of State and county clerk's offices as captured in the exchange's normal course of business. The implementation of this new process has been pushed to the biennium following next to allow for proper planning and design. And so we are actively working closely with the Secretary of State's office, the Division of Motor Vehicles, who implemented something a few years ago, and also Division of Welfare and Supportive Services, I believe, who's also named in the bill. As far as what Heather said, we will be working to try to determine technical impacts with our vendor and how we can get this moving forward. So for the bigger bill, the SB 420, commonly referred to as the public option bill, the insurance vehicle of the public option will be an ACA qualified plan, but sold at 5% below a benchmark silver plan in 2024, with plans to reduce average premium cost savings by 15% over 4 years. These plans will be sold on the exchange platform, and per the legislation will not be available until 2026. Upcoming steps in the upcoming biennium are to conduct an actuarial study to ensure goals and legislation align with accomplishing the legislature's intent of increasing access to health care at a lower consumer costs, and apply for a Section 1332 waiver with the Center of Medicare and Medicaid Services for their approval. The exchange's executive director is explicitly mentioned in this legislation as an integral architect of the public option, and will work closely with the Commissioner of Insurance and Director of the Nevada Department of Health and Human Services. So that's a brief overview of that. Heather, our Executive Director, Heather Korbulik, had also mentioned that this is definitely an incredibly complex, has a lot of moving parts to it. So we are, again, working closely with the Division of Health and Human Services, DOI, to be able to get that actuarial analysis is comprehensive to determine the impact of a public option on the state's healthcare system as a whole. The exchange is committed to working with our carriers, hospitals, doctors, and other interested stakeholders, including labor and trade unions, who have expressed some concerns about what this impact is, how the exchange and the rest of the state agencies intend to move forward with this analysis. So we're having conversations as we continue through this bill and implement it. So that being said, though, so that's kind of a brief overview of what I was given about these bills and the impacts that they have on the exchange and for Nevadans. And that being said, though, we are also very focused and very excited about what's currently happening, and that's with the American Rescue Plan that was implemented in, get back to my, launched April 20th, 21 of this year. It's been a challenge to implement all the rules for this plan. The biggest significant changes were enhancements to the APTCs so that people who either previously weren't eligible for tax credits So over 400% of the federal poverty level are now newly eligible for those tax subsidies, or the subsidies are even more generous for those who were already on the exchange. That has generated a significant uptick in our enrollment. Since April, we've had around 11,000 enrollments under the ARPA, qualifying life events code in our system. Our enrollment is around 85,000 Nevadans, which is higher than it normally would be. So at the end of the OEP, we ended at 88,000, and typically we have an attrition rate of 15%, and that's not happening this year. So we are very focused on the next 4 weeks of this open enrollment period for the ARP, which ends August 15th. We're just focusing our new marketing and advertising company, the Abby Agency, working with them to make sure we're getting this word out to all Nevadans about the affordability that is available right now. And then our next open enrollment will be from November 1st to January 15th of 2022. So we're also looking towards that and working on that. I did ask my chief operations officer what the count of tribal members are as far as having qualified health plans on the exchange, and it's at about 418. And I did have kind of an exciting experience happen just the other day. It's rare for me, but I had a tribal clinic call my office needing help with one of their members who needed help seeing what she would be eligible for on the exchange. And I was able to link her with one of our grantees who's listed on our website, who was able to help her out and assist her. And that was kind of exciting for me. I don't get to be in touch, have that happen very often. So working on outreach, continuing to, and just want to encourage, if you guys have any questions, any kind of help assistance that you need, please do reach out. We're here for you. And I think that summarizes the bulk of updates that I have. So happy to answer any questions, or at least take your questions. If I can't answer them, I will definitely make sure I get answers for you.
Thank you, Tiffany. If anyone has any questions at this time for Tiffany with Silver State Health Insurance Exchange, please feel free to unmute yourselves or raise your hand. Okay, and I'm hearing none. So at this time, we do have on the agenda to take a break. So it seems with all these legislative updates, it seems that this consultation is running a little bit longer. So if it's okay with that, unless there's any objection, we'll go ahead and take just a 5-minute break. Are there any objections to that?
None.
Okay, thank you. Very well. So we'll go ahead and take a 5-minute break. We will reconvene. You can just mute your phones, walk away from your devices for right now. You can turn off your cameras if you like. We will reconvene at, I guess we'll do a 7-minute break if that's okay. We'll do, yeah, we'll do a 7-minute break. So we'll come back at 10:55. Thank you.
And Breeza, just for those who may have to drop for like 11 o'clock meetings and stuff, obviously materials will be put on the website, and the recording, we're going to work on how to make that available to folks who can't stay the whole time and need to work with IT about where that can live or other options for that. So we totally understand if people need to hop off or back on, as that case may be.
Thank you, Oma. All right, everyone, we'll reconvene at 10:55. Thank you.
Have to unmute myself. Hi, everyone. Again, my name is Priscilla Costa, and I am the Tribal Liaison for the Director's Office here at the Department of Health and Human Services. I'm going to take over moderating the second half of the meeting. So I'm going to jump right in and share my screen. Give me just 1 second. Okay, so since today we're sharing legislative highlights, I'm going to share some updates from the Director's Office. As Suzanne mentioned earlier, the Department of Health and Human Services tracked more than 300 pieces of legislation, and 185 of those were signed into law. And then, of course, there's several that didn't make it into statutes or law, but we're still going to keep an eye on what happens moving forward with those bills. From those 185, I kind of chose to highlight some that the Director's Office has a part in. So for AB 119, relating to the Maternal Mortality Review Committee, that law is going to require us to review incidents and trends in severe maternal morbidity in the state and identify and review disparities in the incidence of maternal mortality in the geographic regions of residents of mothers who experience maternal mortality. And then Assembly Bill 143, that's going to require us to develop a statewide plan for the delivery of services to victims of human trafficking and to form a statewide traffic task force to assist the department. Assembly Bill 348 is going to transfer the Patient Protection Commission from the Office of the Governor to the Office of the Department of Health and Human Services Director. AB 365, which is going to require the departments of the state government to prepare and submit a report concerning equity in the workplace annually. And then we're jumping over to Senate bills. Senate Bill 108 is going to require a person who during the scope of his or her employment who has regular or routine contact with juveniles who are involved in the juvenile justice system in the state to complete a periodic training relating to implicit bias and cultural competency. And then Senate Bill 222 is going to require a state agency to collaborate with minority groups and provide certain information to these minority groups. It's going to require state agencies to designate a diversity and inclusion liaison and provide contact information for this person. It's also going to require the Office of Minority Health and Equity in the Department of Health and Human Services to facilitate an annual meeting between diversity and inclusion liaisons and the minority group to submit a report to the governor and the legislative commission. And lastly, Senate Bill 424, and it creates a public health resource office within the office of the governor. So these were just bills that I thought highlighted our commitment to working with tribal communities around our state. But if you would like some more information about the 300 bills that we tracked or the 185 bills that we are now working on implementation steps, please don't hesitate to reach out to me or any of the tribal liaisons, and we'd be more than happy to get that information over to you. I will stop sharing my screen and take any questions if there are any questions at this time. No questions? You guys are letting me off easy. All right, with that then, I will hand it over to the Division of Child and Family Health Services for their legislative update.
Can you hear me? Hello, this is Fran. Hi, I'm the Tribal Liaison for the Division of Child and Family Services. So I'm going to give a brief overview of what bills affected us under child welfare. So let me see if I can share my screen. Okay. And some of these bills Priscilla nicely talked about. So at DCFS, or the Division of Child and Family Services, we have 4 departments. We have child welfare, children's mental health, juvenile justice, and victim services. I am the tribal liaison directly under and having to deal with child welfare. So I was just going to share the bills that affected child welfare or things that have fallen under that category. Some budget highlights: we had proposed reductions to Clark and Washoe County Incentive Program that were restored in SB 460. The amount restored was $6.79 million. Special interim reporting is required for respite and specialized foster care programs. SB 377 establishes a budgetary mechanism to properly execute federal adoption savings reinvestment requirements. Potential for $2 million in funding per year for new placement prevention and services aimed at reducing the time youth spend in foster care. A letter of intent is required for adoption savings expenditures. So the total state general fund for child welfare operations in the child welfare department is $160.9 million. I'm not only the tribal liaison for DCFS, for those who don't know, but I'm also the statewide adoption specialist out of our family programs office. So I do run 2 programs at DCFS. Some policy highlights here. Under SB 376, investigation determinations, as unable to locate or contact, and administrative closure as options for investigations, substantiation determinations by child welfare staff and supervisors. SB 274, commercially sexualized exploited youth, requires DCFS to establish regulations for the licensing of receiving centers to serve commercially sexually exploited children, or we call it CSEC. Adjustments to Child Welfare Agency response to reports of CSEC. Our court improvement program recommended changes. AB 426 allows the Attorney General to seek a warrant to place a child in protective custody, and a child welfare agency or designee to provide a statement or sworn testimony for the need for a warrant to place a child in CPS custody under specific circumstances. This bill provides additional clarification on contact to parents, as well as providing an additional mechanism to ensure the safety of children. AB 115, parentage and paternity determinations, gives the court the authority to determine a parent and child relationship for more than 2 people and prevents the adoption of a child without written consent from all parents. The additional parents may approve the ability for placement of a child with a parent when they have been removed from another parent. AB 33 consolidates court-related matters for child protection and parentage within our NRS or Nevada Revised Statutes 432B and NRS 146. Federal Extended Foster Care, SB 397, adopts changes to Nevada's Continued Jurisdiction Program to comply with federal requirements, and a requirement that DCFS submit a proposal for financial resources to implement the Federal Extended Foster Care Program for the 2023 legislative session. Kin Gap language adjustment, SB 158, slightly adjusts Nevada statutory language related to eligibility for the federal kinship guardianship program. Nevada statute was more restrictive than federal language. This adjustment will expand eligibility for federal funds to additional guardianship placements. So that's great news. So again, that's just a brief overview of what goes on in the child welfare section at the Division of Child and Family Services. If anyone has any questions in regards to Indian child welfare and or adoptions, you are more than welcome to contact me directly. Okay.
And it looks like there's a hand raised from Marla.
Sure.
Hi, good morning. Thank you, Fran, for the presentation. Just quickly, will there be any specific tribal initiatives related to foster care within DCFS?
Sure. Great question, Marla. Nothing, so tied within to our bills, there are assistance and or it does relate to our Indian children here in Nevada. So for anything specific in regards to there is no specific bill, I should say, should state that specifically spells out to the tribes. But within the written language, there is assistance that I can find in regards to, say, foster care or KinGap, which is my specialty here under the division. So you can definitely reach out to me specifically if you are looking or seeking something for a family and or a tribal nation that needs specific assistance in child welfare.
I guess I was speaking more globally about resources to tribes. You know, I know there's a lot of new federal money available, and it seems like it'd be a great opportunity to really expand the resources at the tribal level. So I don't know if it's something that the division wants to consider moving forward, but I'm happy to have a conversation about it. Thank you.
Yes, I agree. Fantastic. You bet.
And it looks like there's also a hand raised, Andrea Johnson Harper. I don't know if her hand is still raised from before.
No, I didn't raise my hand. It was up from the previous question.
Okay. Perfect. We just didn't want to miss you.
Great. Fantastic. Are there any other questions for me? Okay. Okay, great. Thank you.
Thank you, Fran. We will move on to the next item on our agenda, and I will hand it over to the Department of Public and Behavioral Health's new tribal liaison. Jesse, take it away.
All right, thanks, Priscilla. Hi, everyone. This is Jesse Jones. I am the tribal liaison for the Division of Public and Behavioral Health. I'm going to share my screen here. All right, so DPBH had 99 bills that were approved that we were a part of. I pulled out 6 of the 99. Let's see, so we'll just jump right into it. AB 96 is related to emergency medical services, and this bill has created the Emergency Response Employees Mental Health Commission. This will allow the governing entities to get into a joint venture with a nonprofit organization to provide mental health support. AB 187 will designate the month of September as Ovarian and Prostate Cancer Prevention and Awareness Month. AB 205 will make changes concerning the acquisition, possession, provision, or administration of auto-injectable epinephrine and opioid antagonists by private and public schools. AB 304 has revised provisions governing the standards for programs of continuing education for peace officers. This bill will require peace officers to complete no less than 12 hours of CEUs every year, which will address racial profiling, mental health, which will include crisis intervention, officer well-being, implicit bias recognition, de-escalation, human trafficking, and firearms. I'm sorry, was there a question? Okay. AB 336 will require an annual behavioral health care assessment for peace officers or a behavioral wellness visit. Let's see. AB 485 will transfer the Department of Emergency Management and its powers and duties from DPS to the Office of the Military. And I will give Priscilla or Breeza all of the other bills, and they will be available for your review. And that's all I have.
Thanks, Jesse. Are there any questions for Jesse or the Department of Public and Behavioral Health? Okay. We will move on to the next agenda item, and that is Aging and Disability Services. Nikki, are you here?
Hey, Priscilla. Yes, I am here. Is Jay available? She was going to give a presentation on Nevada Care Connection. I'm not sure if she's still on with us.
Ryan, can you hear me okay?
Yeah, we can, Jay.
Awesome. Would you like me to get started?
Sure. If you want to go ahead and get started, and then I can do our legislative update when you're done.
Okay, thank you. Let me go ahead and share my screen. Let's see, how does that look? Is that okay?
Yes, that's
Jay,
great.
See your screen. If you could just speak a little bit louder if you can, or get closer to your mic.
How's this? Sorry,
much better.
guys.
Thank you.
Okay. Well, thanks, you guys. I really appreciate you giving me the opportunity to speak. My name is Jay. I'm with Nevada Care Connection with Access to Health Care Network, and I'm one of the supervisors here. My counterpart is in Elko. Her name is Ashley Drake. But I'm excited to share a program with you. So I'll go ahead and just get started. I'm going to go to our next slide. What is Nevada Care Connection? So Nevada Care Connection, it's a statewide program, and it's administered by different organizations depending on the county. We're administered through or by Nevada Aging and Disability Services Division. And I'd like to read our mission statement just because it really gives a nice overview of why we do what we do. And I'll get into what exactly we do in a second here. But Nevada Care Connection is the one-stop shop access point to systems of long-term and short-term support options, which is person-driven, empowering individuals to make informed decisions about available services. Before I kind of get into that, just a side note, you may have previously heard us be referred to as the Aging and Disability Resource Center, or ADRC, but we've just kind of rebranded a little bit, and now we're known as Nevada Care Connection. So if you hear the two, we're the same entity. And as far as our mission, you know, it's difficult for individuals to already recognize, maybe assistance is needed, and even asking for that assistance can be really challenging. So we're here to kind of help in navigating through, those unique situations that people find themselves in. You'll see just kind of underlined there, empowering individuals to make informed decisions. We really want to make sure that as we're navigating through such a complex system of like public benefits or even, end of life planning, we want to be respectful of, the client's wants, I should say. As people ask for assistance, it can be really intimidating because a lot of times, there's that fear of, people thinking that others are going to determine things for them, or, like a common fear, like for example, is I don't want to be placed in a home. I want to stay where I'm at. I want to stay home and be independent. And, we're always going to have right to self-determination front of mind. But moving forward, I'll kind of get into the other services. With access to healthcare, we've been in partnership with Nevada Care Connection since 2013, and we started off in the rural counties. And as of 2020, we now serve 12 counties in northern Nevada. Pretty much the only northern Nevada county that we don't have under our belt would be Lyon County. But again, Nevada Care Connection is going to be dispersed between different organizations. So Lyon County Human Services serves Lyon County, and I have all the contact information for you for, Southern Nevada as well. And what we do at the core of everything, we've got two main services that we like to provide. And first and foremost, we do resource and service navigation. So that is, one, being able to speak to the individual about, their needs and their goals, and then being able to lay out the options that are available to them. We can assist in reaching some of those goals in predetermining eligibility of programs. We can also provide application assistance with said programs. This is really nice, and kind of circling back to that one-stop shop access point. Sometimes it's difficult, or clients may have barriers with maybe transportation or even ambulatory capacities to be, going from agency to agency to get connected with services. So we can do some of that eligibility screening just all in one place. We can print off those applications, help with them, submit it for them. And that helps eliminate a lot of, confusion that can arise as, you're applying for different programs and whatnot. Of course, we do offer caregiver support. We work with a lot of caregivers. We can help in providing referrals for respite care services, consumer advocacy, and connecting individuals to services and resources that they need. So there's really no topic we won't get into. We've had some really outlandish requests, but a lot of times, most commonly, we're going to be talking about, of course, programs and long-term care planning, maybe in-home assistance, things like that. We now offer long-term case management. This is new for us. So we just kind of started rolling it out. We're building our caseload for that, but this program specifically is catered for individuals who might need a little bit more ongoing assistance. So they're going to receive all the above services that you see listed there, but we're also going to conduct monthly home visits or telephone visits. I know that we're still kind of working on what our boundaries are with this, because we're considered non-medical, but we may be able to maybe help coordinate some appointments if needed. Just kind of depends on the need of the individual. So as far as eligibility goes, of course, target population is going to be older adults and then persons with disabilities. This, of course, involves caregivers, but we pretty much don't really turn anyone away. If anyone, needs assistance in some way, shape, or form, we're happy to assist. If it turns out that maybe that individual could be better assisted by a more appropriate agency, we're happy to make that connection with them. And then as far as long-term case management goes, these are going to be individuals who either fit the criteria above, but these persons typically have a harder time maintaining their long-term support services. Maybe it's due to, a cognitive, issue, or maybe memory loss, TBI. This kind of varies. We've got a little bit of leeway as far as, who can be eligible. The only thing that would make someone not eligible for our services for Nevada Care Connection in general would be if they already have a case manager, simply because we provide pretty much the same type of service, and we never really want to duplicate or make any things a little bit more complicated or hinder any processes that are in process. So we're happy to collaborate with, their current case manager in case, maybe they just need to brainstorm a little bit, or, whatever the case may be. We want to help the client as best as we can. To reach us, you or the individual you're assisting can either call us via our toll-free line. You can email us at that email address right there. And there's also, if you visit our website at nevadacareconnection.org, there is an Assess My Needs form. And sadly, it doesn't work on like Chrome or anything like that. So there's specific browsers it's going to work best with. But the Assess My Needs form is nice because it does kind of like a pre-assessment, and then it sends the referral directly to us. And if you needed to reach someone outside of our service areas, here is Lyon County. So these are the two Nevada Care Connection sites for Northern Nevada. And oh, sorry, one more thing. With the Assess My Needs form on the website, if you fill that out, it'll be routed to its appropriate Nevada Care Connection site, depending on the zip code that you put in there. Here is our Southern Nevada partners. We've got Jewish Family Service Agency and then Nevada Senior Services. They share Clark County a little bit. There's certain areas in Clark that JFSA is going to assist. But of course, you know, as you put in, if you use the Assess My Needs form, it'll go to the appropriate person or agency. And last thing I want to touch on, we are mandated reporters. I like to provide this number here because if for any reason you feel concerned for an adult and whether or not they are, you know, experiencing abuse, neglect, exploitation of some sort, I always encourage that you call. You can always give us a call and let us know, you know, we can talk about it, but if you're already, you know, feeling concerned, go ahead and give them a call. And as we work with clients as well, we'll place reports also. But that's what I have for you. Sorry I breezed through it so quickly. Do you have any questions? Okay, right on. Oh, I might see some hands up. I'm not sure if those questions are for me. I see Andrea and Marla.
No, I think I just kept my hand up. I don't have any questions. This is Andrea Harper.
Yeah, same for me. I don't, maybe we have to drop our hands.
No worries. Awesome. Well, you guys are welcome to reach out to me with any questions at any time, and we're happy to assist. So thank you guys for your time. I really appreciate it.
Thank you, Jay. I appreciate you being on today. So I'm going to go ahead and share my screen as well and go over a couple of the bills that Aging and Disability Services followed during this past session. So we had 42 bills that we were following, and I've just picked out a couple that that I think might help within the tribal communities. The first one is AB 35. AB 35.
Sorry, Nikki, I think you're sharing the wrong screen.
Oh, let's see. Let's see. Hold on. Now I think I've taken everything off.
Nikki, it was showing your email. Oh, there it is.
Ah. Is it up there now?
Yeah, and it's full screen. You're good.
Okay, good. Okay, thanks. Okay, so AB 35, this AB 35 revises the governing and administration of certain programs to assist seniors and persons with disabilities with costs relating to healthcare and pharmaceutical services. Of course, this one was supported by Aging and Disability Services and also had some cleanup language within that bill. In addition, AB 35 provides more flexibility to the division to oversee program administration to ensure the program is meeting the community needs. AB 91, this bill actually really is for the private sector, but it impacts the people that we serve. And it is assists family members with medical needs. So an employee will now be able to use sick leave to assist a member of the employee's immediate family with certain medical needs. AB 344 authorizes the establishment of a program to facilitate a transition of care of older persons and persons with disabilities being discharged from a hospital to their place of residence. Hospital discharge staff and ADSD case managers and other community-based providers will facilitate healthcare and social services to support the older adult or the vulnerable person in their home. AB 96 makes various changes relating to services provided to persons with autism spectrum disorder. With the passage of this bill, ADSD is hopeful that the additional providers will be attracted to the rate increase. And SB 179, this bill revises provisions relating to sign language interpreting and real-time captioning. The intent of this bill was to increase the quality of sign language interpreting services throughout Nevada, providing a pathway for interpreters to achieve required credential standards and provide standard qualifications for members. So if anybody has any questions regarding these bills, I'll be happy to take those. No, okay, that's all. That's all I have for aging and disability services. Thank you.
Thanks, Nikki. Okay, if there are no questions for any of the tribal liaisons, we'll move into item 6, public comment regarding any other issues.
And Nikki, your screen's still up. You might want to stop sharing. Nice background though.
I cannot get this thing off.
And I do see Russell Peak has their hand up.
Hi, Priscilla, can you hear me?
Yes, we can hear you.
Hi, can you guys hear me? Okay, great. I just wanted to quickly mention, this is Russell Peak. I'm community outreach trainer and tribal liaison with MTM, that's Medical Transportation Management. And I just wanted to quickly mention that I'll be reaching out to all of the tribal clinic directors to train their staff on our new MTM Link facility portal or scheduling portal. And this is going to allow staff to schedule non-emergency medical transportation for their Medicaid recipients right from their desktop. And it also allows those clinics and tribes that we have sole source vendor agreements with to set up their trips from this portal as well. And we're currently testing it with Walker River Health Clinic. So once we finish the testing with them, we'll roll it out to the rest of the clinics. So I just wanted to give those tribal clinic directors that are present today on this call just a heads up that we will be reaching out to them shortly.
Thank you for that, Russell.
You're very welcome.
Russell, there was one question that we had at Walker River.
Yes.
And it's also about maybe training your staff at MTM, because I know we just got something. I mean, we're 101 miles from Reno, and now they're asking us for advanced authorization for anybody that's transported from here to Reno. And that's not how we were doing it before.
Yeah, that's that.
But that's what my biller's been getting told and denied on some of the claims. So
okay, we can certainly, we can have a conversation offline. I think I've heard that situation. That should not be the case, but we can definitely take that offline and talk about it. Be happy to, if it's some education needed on our part, we'll get that taken care of. But no, that's not necessarily a requirement, for the tribes that are acting as sole source vendors for us. So
and I asked her to contact you, so.
Okay.
We had another mix-up this morning.
Hey, was it Ken? Who was that was just speaking?
Yes, that was Mr. Richardson.
Okay, great, thank you. Ken, I'll reach out to you directly, okay?
Thank you, that'd be helpful.
You're very welcome.
Are there any other questions for Russell? Or does anyone else have public comment they'd like to share at this time? Okay, we will move on to item 7, our cultural closing. Brisa, did we have someone on the schedule for this?
No, we did. Excuse me. No, we did not. If there's anyone that is willing to do the cultural closing, please feel free to unmute yourselves. Okay. And I believe Augustine was really nice to do the cultural opening, so we really appreciate that. Please feel free to, I understand that sometimes it can be a little nerve-wracking to come on recording and to do a cultural closing. So thank you everybody for everything, and I'll let you. We are going to go ahead and adjourn at this moment. So the time is 11:32 a.m. Today's July 14th, 2021, and this is July's 14th, 2021 tribal consultation hosted by the Department of Health and Human Services. And thank you everyone for your time. I will be following up with an email with attachments and contact information. Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thanks. Bye.
Thank you.
Thank you.